Whether you're a 98-pound weakling or a muscle-bound Adonis, you're going to want to watch the Anatomically Correct World of Anatomy program too. We'll explore the many muscles of the human body, from the biggest to the smallest. We'll work out your mind, exercise your intellect, and let you flex your mental muscles while we teach you all about the human muscular system. You'll even learn about all the joints that help your body bend, grasp, tilt, twist, and turn.
Here's pop quiz time! Which kind of joint is in your hip? Is it A, pivot joint, B, ball and socket joint, C, hinge joint, D, saddle joint? Think you know? We'll give you the answer following the program.
I'm Laura Hopewell, and today we'll learn about human anatomy, in particular the muscular system and joints. We're going to have a great time, and rest assured you'll learn something new. But what else did you expect from the Standard Deviant?
My name's Will. I'm the towel boy at the Neighborhood Health and Fitness Center. My duties include folding towels and also making sure towels get folded. They gave me a novelty t-shirt. It says Fold King. Sometimes I wear it to the park. And I'll tell you, working in a place like this, you can sure learn a lot about muscles. I mean, sure, there's 3 different types of muscles: cardiac, smooth, and skeletal. And skeletal is the only type you can see, but what you can see, pretty impressive. Hey, thanks, Rex. Fold King's on the job.
There are 3 fundamental types of muscle tissue: cardiac, smooth, and skeletal. Cardiac muscle forms the walls of the heart and contracts to propel blood through the blood vessels of the body. Cardiac muscles are involuntary. Involuntary muscles are muscles we have no conscious control over. Cardiac muscles are striated, which means the muscle tissue has obvious stripes or striations.
Smooth muscle forms the walls of hollow structures, like the digestive tract. It's also responsible for changing the diameter of these tubes to move stuff like food through them. Smooth muscle is controlled by the autonomic nervous system. Basically, that means that smooth muscle works without any conscious help from us. It's on autopilot.
Smooth muscle cells are unstriated. That means they don't have the stripes that cardiac and skeletal muscles have. But like cardiac muscles, smooth muscles are involuntary. We can't control them consciously.
Skeletal muscles, the final division, are typically attached to the skeletal system, hence the clever name, skeletal muscles. These muscles are the most plentiful, and their names are hard to memorize, so we're going to focus on them for a while.
The skeletal muscles are also responsible for body movements and facial expressions. Throwing balls, running from the police, frowning in disgust, all these things are the bread and butter of skeletal muscles. Skeletal muscle cells are elongated, striated, and under voluntary control.
So when you think skeletal muscles, think striated and voluntary.
Apart from movement, skeletal muscles have a number of other responsibilities. Skeletal muscles help you stand. They maintain posture by resisting the pull of gravity. Nothing can resist the downward pull of gravity. Just watch. Hup. It's impossible, I tell you. Impossible. I appreciate and understand your concern, insane man, but the skeletal muscles actually can do it. They can also adjust themselves to stabilize joints and even generate heat during muscle activity. Heat? By God, where can I get me some skeletal muscles? You already have over 600 of them. Isn't that wonderful?
But there is one catch. You see, skeletal muscles are named using 7 different naming criteria. Within each muscle's name, there are certain descriptions that characterize the muscle. These naming criteria are location, shape, relative size, direction of fibers, number of origins, origin and insertion, and lastly, action. Knowing these naming criteria will help you identify muscles more easily on an exam, or help you understand more about individual muscles when you hear their names.
Location refers to the bone or bones that are directly associated with the muscle. For instance, the temporalis and frontalis muscles are named for the cranial bones underneath them. The temporalis is above the temporal bone, and the frontalis is above the frontal bones. Piece of cake.
Shape describes a muscle's approximate shape. For example, the deltoid muscle is triangular. In case you don't know, delta is a Greek symbol shaped like a triangle. And the trapezius, another muscle, is in the shape of a trapezoid. Simple, isn't it?
Another way to classify muscles is to relative size.
For example, the terms maximus and major refer to the largest group of muscles. On the other side of the coin, the terms minimus and minor refer to the smallest group of muscles. Longus and brevis are two other muscle terms that describe size. The term longus refers to the longest muscle in a muscle section, and the term brevis describes the shortest.
The direction of fibers describes the orientation of muscles relative to the long axis of the body. The long axis of the body runs from head to toe, so muscles can be rectus, meaning straight. In this case, they're flush with the long axis. Muscles can be transversus, meaning across. This means they're perpendicular to the long axis of the body. Or, muscles can be oblique, meaning they're oriented at an angle to the long axis. It's as simple as that. Rectus straight, transversus across, oblique, angle.
The number of origins refers to the number of attachments a muscle has to bone via tendons.
The origin and insertion of a muscle describes its attachment to bones. Origin describes a muscle's attachment to immovable bone, and insertion describes its attachment to movable bone. Take the sternocleidomastoid muscle. This muscle originates from the sternum and clavicle. In simple terms, that's the beginning of the muscle. But the sternocleidomastoid eventually inserts itself on a part of the temporal bone called the mastoid process. We get sterno from sternum and cleido from clavicle. Then we get mastoid from mastoid process.
Put it all together? Sternocleidomastoid. It's like a puzzle for science lovers.
The next muscle classification is action, which indicates the type of movement a muscle creates.
For example, the flexor muscle decreases the angle between bones, like when you're lifting up a dumbbell, the flexor flexus. The extensor increases the angle between two bones, like when you're bringing that dumbbell down. The extensor extends.
And that's the 7 criteria for naming muscles: location, shape, relative size, direction of fibers, number of origins, origin and insertion, and action. Now, not all muscles use these 7 criteria in their names. They'd be way too long. But there are some muscles that are described using a number of them. So it's a good idea for you to be familiar with them all. A good way to remember all these ways to classify muscles is by using the phrase lad snore. You see, each letter in this word is the beginning letter of a term used to describe muscle orientation and location. Commit it to your memory, lad snore. A little English boy who can't sleep quietly.
I wish I could stop snoring.
Hey, 'tis true, the lad snore.
Being familiar with all 7 muscle naming criteria does make it easier to identify the skeletal muscles.
Okay, we're going to take you through a bunch of the skeletal muscles. You know, their names, what they're responsible for moving, stuff like that. And to assist us, we're going to get a little help from Stan and Carl. Thanks, guys.
The main muscle of the scalp is the epicranius, which is made up of the frontalis and the occipitalis. Important muscles of the face are the orbicularis oculi, zygomaticus, risorius, orbicularis oris, and the buccinator. It's easy to remember the muscles containing the prefix orbit because it should remind you of the orbitals in the cranium.
The 3 important muscle pairs connected with mastication or chewing are the masseter, temporalis, and pterygoids. The muscles that move the tongue when we speak and eat are the intrinsic muscles. The intrinsic muscles change the shape of the tongue itself. The extrinsic muscles are also important to the tongue because they anchor and move the tongue around inside of the mouth.
Now let's look at the muscles of the anterior neck and throat.
Ah, these are the muscles that help us swallow. All right, Dan.
The muscles of the anterior neck and throat include a bunch of muscles that attach to the hyoid bone. These include the suprahyoid muscles and the infrahyoid muscles. Behind all these muscles that move the hyoid and voice box is the pharyngeal constrictor muscle of the pharynx. This muscle helps us swallow.
Other muscles of the neck are responsible for movement of the head and body trunk.
The muscles responsible for moving the head and neck are the sternocleidomastoid, scalenes, splenius, and semispinalis. The trapezius muscles of the back also help move the neck and head, but we'll cover them in more detail later on. The muscles that help move the trunk of the body are the erector spinae, the semispinalis, and the quadratus lumborum. All right, those are the muscles of your head and neck region. Now let's move south and check out the muscles of your thorax. Here we go.
Now, I double dare you to breathe the deep muscles of your thorax.
The deep muscles of the thorax are easy to remember. They're located around the thoracic cavity. They are the external intercostals, the internal intercostals, and the diaphragm.
Most people believe that the superficial muscles of the thorax are the same as deep thoracic muscles. This is not true. The superficial muscles of the thorax actually act on the scapula to create arm movements, like pushing or punching.
The superficial muscles of the thorax are the pectoralis major, the pectoralis minor, the serratus anterior, the subclavius, the trapezius, the rhomboids, and the levator scapulae.
The muscles of the abdominal wall control the movement of the body's torso and provide protection for internal organs. When the abdominal muscles contract, the pressure within the abdomen increases. This helps us to sneeze, vomit, cough, scream, give birth, burp, and blow our noses.
Next up are the muscles of the pectoral girdle. The muscles of the pectoral girdle move the arm by directly acting on the humerus and help with actions like swimming, hammering, and rowing.
Muscles of the pectoral girdle include the pectoralis major, the latissimus dorsi, the deltoid, and the teres major. Also included in the group of pectoral girdle muscles are the rotator cuff muscles, which include the teres minor, the subcapularis, the supraspinatus, and the infraspinatus.
I think you're beginning to see that there are quite a few muscles in your body, and they're all important. Let's move on to these guys, the muscles of your limbs.
The muscles of the arm help to move the forearm.
The muscles of the arm cross the elbow joint and insert on the forearm in order to move it. They are the triceps brachii, the biceps brachii, the brachialis of the arm, and brachioradialis of the forearm.
The superficial muscles of the forearm are the pronator teres, the flexor carpi radialis, the palmaris longus, the flexor carpi ulnaris, and the flexor digitorum superficialis. The deep muscles of the forearm include the supinator, the abductor pollicis longus, the extensor pollicis longus, the extensor pollicis brevis, the extensor carpi radialis, the extensor digitorum, and the extensor carpi ulnaris. The muscles of the hip are responsible for moving the thigh.
The muscles of the hip include the iliopsoas, the sartorius, the adductor magnus, the adductor longus, the adductor brevis, the gracilis, the gluteus maximus, the gluteus medius, and the gluteus minimus.
The muscles of the thigh are the muscles that move the leg. In our context, the thigh and the leg are different. This is the thigh, and this is the leg.
Muscles of the thigh include two major groups. These groups are the quadriceps, which extend the leg, and the hamstrings, which flex the leg. The four muscles in the quadriceps group are the rectus femoris, vastus lateralis, medialis, and intermedius. The hamstrings are composed of the biceps femoris, the semitendinosus, and the semimembranosus.
Now the muscles of the leg move the ankles and toes.
The muscles of the leg include the tibialis anterior, the extensor digitorum longus, the peroneus, the gastrocnemius, and the soleus. Also included are the deep muscles of the leg. These are the flexor digitorum longus, the popliteus, the flexor hallucis longus, and the tibialis posterior.
Hey, muscles are great. I'm not going to argue with you there. But without joints, I don't think you'd be doing much of anything. I mean, you wouldn't be able to do this, you couldn't do this, and you certainly couldn't do this. I used to be a breaker.
Joints are sites where bones join together to make movement possible. Without joints, we'd be unable to run or do push-ups. Now, joints can be described and classified in two different ways. They can be described functionally, or they can be described structurally.
Joints are divided into 3 different functional classifications based on the degree of movement they allow. These classifications are synarthroses, amphiarthroses, and diarthroses.
Synarthroses refer to joints that are immovable. These types of joints are found in places like the cranium. Synarthrotic joints lock bones together. They just won't budge.
The classification amphiarthroses refer to joints that are slightly movable. They're not rambunctious or hyper, but they do move a little bit. These joints are found in places like the vertebral column.
And last, but by no means least, the classification diarthroses refers to freely movable joints. These are the types of joints found in upper and lower limbs.
In addition to all this, joints can also be classified by their structure. The 3 structural joint classifications are fibrous joints, cartilaginous joints, and synovial joints.
The first structural joint we'll talk about is the fibrous joint. Some joints have little fluid-filled spaces between bones. These little fluid-filled spaces are called joint cavities. Fibrous joints do not have joint cavities. Fibrous joints are joints where bones are united by fibers of fibrous tissue at their joint sites. Fibers. Fibers. Hey, it's fun to say fibers. One specific type of fibrous joint is called a suture.
Now everyone has sutures in his or her skull. These sutures are made up of interlocking or overlapping bone edges that are connected by short fibrous fibers. The term fibrous fibers may sound redundant, but hopefully it'll make you remember the name of the fibrous joint. 2 other types of fibrous joints are syndesmoses and gomphoses.
In syndesmoses, bones are connected at their joint sites by long fibrous cords or sheets. Fibrous, get it? You can find an example of this joint in the lower leg, between the tibia and the fibula.
Another cool fibrous joint is the gomphoses. Gomphoses are the joints that connect the teeth to their tiny bony sockets in the jaw. They are attached with fibrous periodontal ligaments.
Are you catching a trend here? Fibrous joints use fibers. Another type of structural joint classification is the cartilaginous joint. Now, can you guess what substance connects bone to bone in a cartilaginous joint?
Cartilaginous joints are joints where bones are connected by plates of cartilage. Like the fibrous joint, the cartilaginous joint has no joint cavity. They are amphiarthrotic or slightly movable and are usually found in the axial skeleton.
A good example of a cartilaginous joint would be symphyses.
Symphyses are flat, frisbee-like discs of cartilage between the vertebrae. The proper name for these frisbees is intervertebral discs. Symphyses are also found between the vertebrae and in the pubic symphysis of the pelvic girdle.
The synchondroses are another fine example of cartilaginous joints. The synchondroses are joints made up of superflexible cartilage called hyaline cartilage. These joints are found in structures called epiphyseal plates. Epiphyseal plates are found in long bones like the humerus and the femur. These plates allow for linear bone growth in places like your arms and legs. That's longitudinal growth.
The final structural classification is the synovial joint. These joints consist of bone ends that are separated by a joint cavity filled with synovial fluid. Synovial fluid is a liquid that reduces friction between bones. Synovial joints come in 6 exciting varieties: gliding, hinge, pivot, ball and socket, saddle, and condyloid.
The gliding or plane joint has a flat surface and allows for sliding movement in between bones. The gliding joints are found between ribs and vertebrae and in the joints of the wrists and ankles. The joints in the wrists and ankles are known as the intercarpals and intertarsals. Makes sense, doesn't it?
The hinge joint, found in the elbow and knee, is made up of the convex end of one bone that fits into a concave groove of another bone. Remember, convex bulges out and concave caves in. The hinge joint kind of works like the mechanical hinge you might find on a door. The pivot joint is another important joint. It has a rounded surface that protrudes into a ring formed by a bone and ligament.
Pivot joints are found between your first and second cervical vertebrae, called the atlas and the axis. Remember, your cervical vertebrae are located in your neck, and the pivot joint is the joint that allows you to shake your head no.
The next major joint is the saddle joint. The saddle joint is found in the thumb, and oddly enough, looks kind of like a saddle. The saddle joint allows for both up and down and side-to-side movement.
You can find the ball and socket joint in both the shoulder and hip. It consists of a large spherical head that fits into a large concave cavity and allows for all types of movement, making it the most mobile joint.
In fact, you remember the three functional classifications of joints? Synarthroses, amphiarthroses, and diarthroses? Well, the ball and socket joint is a diarthrotic joint because it's super mobile.
The condyloid joint, located in the knuckles and wrists, consists of a small condyle, or projection, that fits into a small depression and allows for side-to-side and up and down movement.
Well, there you have it. You are now a joint scholar. You know about the three functional classifications of joints, as well as the three structural classifications.
There's one more thing we have time for today on Standard Deviant TV. Joint problems and how we handle them.
When studying joints in the human body, it is very important to take into account common yet very painful injuries. These include sprains and dislocations.
A sprain involves the stretching or tearing of a ligament which unites bones at a joint. A sprain is extremely painful. Sprains can be partial tears or complete tears.
Partial tears heal very slowly because of lack of blood flow to ligaments. Complete tears must be repaired surgically, and surgery is very frightening, even if you can bench press your own weight.
Often, when a ligament is completely torn in athletes, it must be replaced with a ligament from another region, an artificial ligament, or a ligament from a cadaver.
That means dead guy. Having a piece of dead guy inside you is very frightening, even if you can body slam a steel girder. Dislocations are also very painful.
Joint injuries are painful, but joint disorders are often prolonged and more serious. Arthritis is an example of a serious joint disorder.
Arthritis is a general term that refers to over 100 different kinds of inflammatory diseases. There are three common kinds of arthritis: osteoarthritis, rheumatoid arthritis, and gout.
Osteoarthritis is the most common condition. You remember cartilage, the flexible material found in joints and other places? Well, with osteoarthritis, cartilage is destroyed. When this happens, little chips of bone called bone spurs form, making movement extremely difficult.
Rheumatoid arthritis is another form of arthritis. It causes destruction of cartilage, fusing bone ends together so joints can't move anymore. You can imagine how painful that might feel.
Gout is a disease that's caused by a buildup of uric acid in joints. Uric acid is a natural bodily secretion, but in excess it can lead to the melding together and immobilization of joints. The most common joint affected by gout is the hallux, or big toe. Gout can be prevented by avoiding foods containing the nucleic acid purine, like liver.
Well, it shouldn't be that hard to avoid liver. Let's take a look back at what we've learned today. First, muscles. There are three fundamental types of muscle tissue: cardiac, smooth, and skeletal. Cardiac and smooth muscles are involuntary muscles, which means we have no conscious control over them. Skeletal muscles, on the other hand, are voluntary, which means you can move them any old time you want. There are 7 different naming criteria for skeletal muscles. Remember Ladsnor, location, action, direction of fibers, shape, number of origins, origin and insertion, and relative size. Now, joints. Joints are sites where bones join together to make movement possible. Joints can be classified functionally or structurally. The functional classifications are based on the amount of movement they allow. Synarthroses are immovable. Amphiarthroses are slightly movable. Diarthroses are completely movable. The structural classifications of joints are fibrous, cartilaginous, and synovial. Fibrous joints connect bones with fibers. Cartilaginous joints connect bones with cartilage, and synovial joints are sites that contain a joint cavity filled with friction-reducing synovial fluid. Lastly, we learned about joint problems. like sprains, dislocations, arthritis, and gout.
Thanks for watching, guys. It's been fun. I'm Laura Hopewell. Be sure to tune in next time for another fun and informative episode of Standard Deviant. See ya!
Here's a fact that you probably didn't know about your hamstrings. The name hamstrings originally referred to a part of a pig's leg. Butchers would commonly string up a hand by this muscle group so that the carcass could be smoked or cured. Hence the name hamstrings. It's time for the answer to the Mike quiz. We ask, which kind of joint is in your hip? The answer is B, the ball and socket joint. The ball and socket joint consists of a large spherical head that fits inside a large concave cavity, making it the most mobile joint of all.
This is PBS. To order this or any other Standard Deviant School products, call 1-800-238-9669 or visit www.standarddeviants.org.